Good afternoon. Can you guys hear me okay? All right. Well, I hope you all have been enjoying today as much as I have. What a great topic for our community. I really love and I'm honored to be a part of this. And we are hitting that point in the afternoon where we will be testing our own resilience in ways. I know you guys have been doing a lot of listening today. I am going to try to present something very practical and hopefully useful in your day-to-day lives, and appreciate you coming to hear about this. I don't have my own personal slam dunk video like Gary did, which is sad to me. I would love to have my own slam dunk video, but I do have a slide I want to briefly touch on before we dig in, which is a special thank you to Phil Collins. Is that you, Phil? I haven't met Phil. Phil works at Bear River Health Department and has very, very generously allowed me to use many of his slides for our up-to-date information on Utah statistics today. So thanks very much, Phil. I appreciate it lots. One thing that I want to let you know about right off the bat in the community, Phil and Bear River Health Department offer to our community a 1-hour training to community organizations, community groups, places where people are employed, a training on what to do if you encounter someone who's suicidal. It's an outstanding training, it's evidence-based, and I believe it's free to anyone who requests it. So Phil gave me permission to put his contact info up here, and love that that's available to people in our community. And as a teenager of the 80s, I did resist the temptation to play Phil Collins music in the background. It was tough, but I was like, no, he deals with that enough. So I wanted to start out by sharing a couple slides about statistics with suicide in Utah. We live in kind of a unique state, right? And I think sometimes we feel like we're a bit immune to problems that affect the rest of the nation. And I feel like this slide shows well, the blue line is the national average for suicide rates, and the red line is Utah. So you can see that for years, we have been above the national average in completed suicides. And so this is very relevant to each of us. In 2016, we lost 620 citizens by suicide, 32 of those being 17 and under. And we're ranked #1 in the nation for suicidal ideation. So if you may mistakenly think we're immune to this, we're very much not. I want to just real briefly share a personal experience I had a couple years ago with this. I've been really fortunate in my life to be a borderline obnoxiously happy person and have never experienced depression. Until a couple years ago, I got hit with some sort of illness. I don't know, they couldn't figure it all out. Had to go on strong antibiotics for a month, and it wiped out my gut serotonin. About 90% of your serotonin is produced in your gut, not your brain. And I got this little taste for about 3 months of what it's like to experience severe depression. And I am here to tell you, it is a butt kicker. I think of myself as a resilient person. I'm an athlete. I don't know, I had a baby. I feel like I've done hard things, like I'm tough, I'm strong, I pride myself on that. And even as a specialist in working with severe treatment-resistant depression and suicidality, I had no idea. And so it was a really important experience to have as a professional. I was very lucky that it was more medically related and we figured it out and I'm back to my cheery self. But not everyone is that fortunate. And so that's the other thing. Not only are we not immune to it in Utah, but personally, I would have never guessed that that would have been a resilience battle I would have ever had to fight, but it was. And so I guess that would be my advice, is like, it's better to be ready. How many of you in the room have been in a situation where either yourselves or someone you care about is battling suicidality? Almost every single hand in the room, yeah. Life is very generous in that it puts us in the blender every once in a while. I tell college students up here now all the time of, be ready. If it hasn't already, it'll put you in the blender here and there. And that's our goal, is like, let's be ready for that. It's coming. Not to be negative. Life also is amazing and beautiful and all these cool experiences, but it's a mixed bag. So that's what we're going to talk about today, is specifically the kind of resilience that it takes when you're battling suicidality, and how we as caring connection people in our community can help others win this battle. A couple of thoughts on suicide. Good news, suicide is not inevitable. We know that 90% of people who attempt suicide and go on to get help never die by suicide. And that's really hopeful. Really encouraging that usually if we know and we treat people, we can most often prevent it. The bad news is it's not always preventable, and this is something I want to really kind of highlight a bit with my presentation today, because we're going to be talking about how to maximize odds of winning this battle. But just because I know the numbers, I know many of you in here and myself also have lost people we love to suicide. And the point is not to, it's so hard when that happens to not look back and, what did I do wrong? I wish I would have this, I wish I wouldn't have that, which is not helpful to anyone. Sometimes people are receiving excellent care and their families and friends are all there and super supportive, and we do sometimes lose people. But we want to do everything we can to give people battling this their best chances. So I've put together 3 pieces that I feel are most helpful in helping people with that battle. I've spent a 20-plus year career. This is my life work, to help people in these situations. And as I put it together, I basically came up with these 3 steps. Step 1, which is the step 1 of almost everything, is just awareness, that we know what to look for so that we can do what we need to do. And I'm going to kind of cruise through these. There are verbal warning signs, behavioral warning signs, and situational. And again, thanks to Phil for these. I even poached your pictures, Phil. So verbally, sometimes people just come right out and say it. I'm going to commit suicide. I've decided to kill myself, and it's pretty obvious. Other times it's more hinting. And I want us all to take a second here, because so many times in my career, I've had these moments where someone says something and you're just kind of like, wait a second, but then the conversation goes on. Like, for example, oh, hey, don't worry about it. You won't have to put up with me much longer. And you're like, and right there, that moment, we want to grab that moment and go, hold on a second. What did you mean by saying, I won't have to put up with you any longer? And we'll go more into the kind of very direct questions that you want to ask. If you even get that blip on your screen, it's very much best to just ask directly about the person and what's going on for them. These are all statements made by people who went on to commit suicide, and they're ones we hear a lot. Behaviorally, there are things that we know when we see certain behaviors that's associated with an increased suicide risk. Anyone who's previously attempted is at higher risk. Someone purchasing a gun or accumulating a pill stash. Increased risk-taking, like stopping wearing your seatbelt, little things to bigger things. Giving away prized possessions, putting personal affairs in order. I have a long-term client who used to tell me, I put my funeral together today. That's kind of one of those indirect, hinty things and a behavior thing. Self-destructive acts, when people are self-harming, that puts them at higher risk. Unexplained anger, aggression, irritability, I think it's Schneidman, if my aging brain remembers correctly, in the late 80s, put together this formula. Suicide's a very, very difficult thing to predict. And so we're always trying to figure out the formula so that we can prevent it. And Schneidman in the late 80s came up with a model that looked at 3 factors: pain, psychological pain, and this is a unique kind of pain. It's that drop you to your knees, excruciating, in the depths, in the belly of the whale is what I call it with my patients, type of pain. Press, which is stressors. Gary this morning talked about his friend who committed suicide, who all these horrible things had happened to them. And the more, like we saw from Dr. Red's presentation, the more adverse events, the higher the risk. But then the third one they called perturbability, which is kind of like this agitation that has an energy to it. And anger's like that too, and irritability. People are at their highest risk then, even more so than when they're so depressed they can't even get out of bed, because it actually takes a bit of energy to do it. And so when we see that kind of energy with the other things, we're paying especially close attention. And then alcohol and drug use, mostly because it creates a impulsivity piece. Situationally, we know this is life putting you in the blender stuff, that when people experience certain things, they're at higher risk. Anything with humiliation, particularly in public, like being fired, or maybe your child applied to 5 different colleges and didn't get in, being expelled. Losses of any major kind, whether it's by death, particularly by suicide, is very high risk. But even divorce, losses that don't necessarily involve death. Fear of becoming a burden to others, whether that's receiving a chronic disease diagnosis or aging. Financial problems, particularly if the person has a sense of hopelessness. And hopelessness is another kind of feeling we want to really look out for with suicide. When people cannot see their way through the problem and everything feels hopeless, that's when sometimes suicide will come in as the solution because other things aren't. Losing your freedom, whether that's legal issues or physical accidents, and then being a victim of abuse or bullying or any kind of trauma. So when we see those warning signs, any combination, or there's not really any exact formula. You may see one or many of these and the person's not suicidal at all, but these are kind of the pay a higher level of attention than you might otherwise pieces. We want to take immediate action. And I want to look at 3 parts to this: asking, listening, and helping the person to get help. With asking, We want to ask right away. Like I said, as soon as you get that uh-oh feeling, right away. Barriers to asking, sometimes people don't ask, it's awkward. It's gonna be awkward. We need to swallow and ask anyway. Sometimes people are afraid, gosh, what if I mention this and give the person ideas? It doesn't work like that. We're all aware of suicide as an option or choices that we have about our life. And it doesn't work like that asking that the person would have never thought of it and now they are and now they want to do it. So we don't need to be afraid of that. It's much more risky to not ask and have the person feel like people don't care, they're not noticing, or they don't matter. How we ask, there are a few pieces to that. Number one, privately, asking is all about creating a safe environment for the person to open up with you. It's all about emotional safety. And so, if possible, pulling the person aside or talking one-on-one with them makes it safer. We also want to be really direct. Are you thinking about killing yourself? Are you having suicidal thoughts? Are you making plans for suicide? We have these little fold-out cards that will actually summarize a lot of what I talk about today. And I like how they word the question on here. It's something like, have you been hurting so much lately that you're having thoughts or plans of killing yourself? But not indirect might be like, do you ever just wish everything would end? Because we're not really sure what that means if they say yes or no. And then gently versus shaming. You're not thinking of doing something stupid, are you? There are those of us, and I am in this camp, that when I see a problem, I want to identify it, make a plan, fix it now. And sometimes people, when they feel anxious or worried about someone, their tendency is like, no, we're not doing this. I'm just going to make sure. And that's not really the best approach. It's better to be gentle. Sometimes we need to be persistent because we may ask, are you thinking of killing yourself? And the person might say, oh, don't worry about me. And they kind of dodge answering. And again, it's like, grab that moment, hold on a second. I am worried about you. I do care about you. And I really want to talk to you about this. I'm concerned. Are you having those kind of thoughts? So those are some hows of asking. After we ask, we need to listen, and we need to listen patiently. Sometimes people have been stuffing feelings and pain and trying to put on the okay face for years. And once they start talking, that sometimes they need to talk a lot. And so we want to be patient listeners. My best piece of advice with listening, and it's something I feel I'll be working on for a lifetime, is to be a curious listener. Hang on to that phrase in your head, because sometimes people are worried about saying it just perfectly and asking just perfectly, and oh no, did I screw it up? And then we get all in our heads. Really, it's like, let your concern for the person happen and come through. And if you can approach it with curiosity, everything else will kind of flow from there. I thought it was interesting this morning when Dr. Red was saying he would ask the people at the jails that he works with, like, tell me about your childhood. And you could feel, couldn't you feel his curiosity? So kind of like that. And non-judgmentally, always, because it comes back to that safety. So here's some questions, some scripts that contrast. A curious question, let's say you're talking to someone, they're like, oh, I'm just feeling so trapped, I've got all this school debt, and I'm never gonna patch things up with my girlfriend, she's done with me, and the person's talking about it, or maybe they're just saying trapped. You could say, well, what's going on in your life that's leaving you feeling trapped? And don't be afraid to ask a bit about it, because one thing I've learned in my career is stuff that just doesn't make any sense right away. If you listen long enough, it will make sense. There's a reason why people are feeling the way they're feeling. No one likes to feel this just, for fun. It's not fun. Versus judgmentally, and here's that, sometimes people think of it as tough love, and I really feel like there are places for tough love. I have coached basketball for many years, and I'm strict. I'm a strict parent, and I can get down to business, but this is not really the place to get sort of angry tough with the person. So judgmentally, you're not trapped, and I can't believe you'd even consider doing that to your family. That is so selfish. That will just shut the person down really quickly. Another active listening thing we can do is after we listen, just restating, and therapists get made fun of this all the time, right? Where you'll see videos like, so what I hear you saying is, and people are like, wow, they get paid to do that. But there is an importance to restating, and sometimes you're kind of summarizing what you hear. So it sounds like you're feeling pretty hopeless. And then maybe you validate. That must be really hard. You're not validating the idea to kill themselves, but you're validating that what they're experiencing is real and difficult. As opposed to minimizing or invalidating. We all get down sometimes, you'll be fine. I grew up in North Dakota on a farm. That's sort of the North Dakota farm approach is like, quit your complaining and get back to work sort of thing. And there's some toughness in that is part of resilience too, but not when someone is in a situation like this. Compassion, just to let them know you're feeling for them. I'm really sorry that you're hurting so much right now. Instead of getting in fix-it mode. And I cannot tell you how many times I have heard that last one of people telling people, you just need to do more service and you'll feel better. Service is awesome, but would you ever say that to someone with cancer? You just need to do service and your cancer should quickly resolve, right? That would be nuts. But we say this to people with depression a bit too frequently. And we'll talk a little bit later about maybe how to incorporate service, because service is a great thing. I'm not anti-service. Oh, this is a little exercise I thought you guys might be interested in. I do this with clients almost any time they're suicidal. So when I first started in my career, I worked on the behavioral health unit at Logan Regional, and every day we were working with people off suicide attempts. And my first effort is always just listen and be a curious listener. And so I would ask them, not just what are your stresses, but like when the thoughts come or the urges come, what's the pull? What feels enticing about it? And these are some things that patients have told me over the years. Suicide would end my suffering. It would make it so I don't feel like a failure every day. It would stop my panic attacks. It would make it so I'm not a burden to my family. Sometimes it's a little more like a little bit revenge oriented, make my wife regret ever leaving me. Those are more rare, but they're out there. Make people realize how much I was hurting and have compassion. Suicide would just give me a break from my life. It's so stressful and hectic, and I'm just burned out and overwhelmed. I can't remember how long it was after I was working on the behavioral health unit, but I had done this exercise with someone one day, and this isn't all of it, in case you guys are wondering why I'm having people list sort of the good reasons to do it. But it really struck me one day. Does anything strike you about this list? Anything you guys notice about this? It took me forever, but like here's kind of what I realized. I'm like, these goals that these people have are so healthy. right? Almost, okay, the make my wife regret, maybe not super, but also not the worst thing of like someone left you and you kind of wish they regretted it, right? That's not the worst thing. Every other goal on there, I'm like so healthy. Of course you want your suffering to end and not feel like a failure and on and on. So this is something I point out to clients of like, these are awesome goals. It's the method that's the problem. And so when people say, I can't understand why someone, why they would ever do this or think of this, this is why. And look at that. And I'll have one person, we always have at least 5. It's powerful, and if you don't see a different way out of that suffering, it's going to pull. So then what we do is kind of look at, would this method actually achieve that goal, A, and B, even if it would, are there better methods that would achieve that goal? And this is kind of a mixed bag. I mean, some it probably would achieve it, like suicide would stop my panic attacks. I mean, I guess so. And then it's like, what do you think would happen to you if you took your life? But it might well stop your panic attacks, but are there other methods? Have you ever had treatment? Have you ever learned anxiety reduction skills? Here at USU, it's been so fun this year. I have worked with, I estimate about 1 student a month who's suicidal and comes in, and I'll ask them, have you ever had treatment? And they've never had treatment. And I'll tell them, oh, such good news. You have a great prognosis. We have treatment approaches that are very, very effective with this. And I can teach them to you. And with depression, 75% of clients who come in and receive treatment, and sometimes that includes medication, sometimes it's just therapy, don't even meet criteria for depression anymore. They needed some tools in their toolbox or some treatment. Even if they have, a lot of my private practice people, I have a subgroup of my clients, I call them my warriors. They've battled depression and suicidality their whole life, and they are truly warriors. Even if you have gotten treatment, have you considered getting more intensive treatment or more specialized treatment? There are better methods. Sometimes the answer is that suicide wouldn't get you that at all. This one, the idea that suicide would make it so I'm not a burden to my family, that often comes up when a person feels like I'm just creating more problems for the people that I love. But I get pretty straightforward with people here. It's not that you want to heap guilt on someone when they're already struggling, but to say, hey, I've seen a lot of families after suicide, and it's the only sure way I know for you to guarantee that you would create a very deep emotional burden for your family for the rest of their lives, because it's devastating to lose someone to suicide. And then a lot of them, what I find is a lot of people just don't know, would suicide make it so that it ends my suffering? And I found here in this area, when I ask people, what do you think would happen? Most people have kind of guesses, but they don't feel very sure. And a lot of people feel like there would be some consequence to that action that would not mean the end of their suffering. And then again, we talk about, well, that's such a great goal, let's keep that, but how about we swap in treatment? Or sometimes it's more straightforward things like, I feel so overwhelmed in my life, I feel like I'm just on the rat's wheel. Do we need a schedule adjustment? Do we need a vacation? Do we need to learn self-care tools? So my point of this is not to try to teach people how to do a suicide intervention, because that should ideally be left to professionals. But this idea that when you really listen, it can guide you toward other solutions for the person, and that's what they need, is that there's a different way to get these great goals that they have. And so then the third step, after you ask directly, listen, maybe explore with them, you want to help the person get professional help right away. I'm going to start down here. Logan Regional Hospital's emergency department, you can take the person there 24/7. They have an on-call behavioral health specialist who will assess whether the person needs to be hospitalized for their safety or whether they can put together an outpatient plan sufficient. And that is a really great resource in the community that I'm very grateful for. Sometimes people will resist, oftentimes people will resist going in. We have a new resource here at USU, and it's available to anyone, called Safe Utah, where you download this app for free. And I have little cards with Safe Utah. And on your screen, you have some choices. By simply tapping, you can be on the phone immediately with a licensed mental health professional to talk this through. So if you're with your child, or you're with a student, or you're with a friend, sometimes it's like, hey, I learned about this app. Let's download it, and let's have you give this person a call, and I'll stay right here with you. Or do you want me to dial? Or I can talk to him first. You can offer that support just to get that ball rolling. Another thing I really like about this, especially for younger people, is you can also text back and forth with a licensed mental health professional, because sometimes people just don't want to talk right now, but they'll message. So that's a pretty neat resource out there. And we've had for many years the National Suicide Hotline, the 273 Talk. That's staffed by volunteers, but they're well trained and another good resource. So those are things you can do immediately. And then finally, there's a long-term support piece. So say you're married to someone who struggles with this, or your child, or there's a long-term support, and there are two basic parts. We want to support that person's ongoing treatment, if ongoing treatment is what's required for them. Most people with depression will do a course of individual therapy, and then maybe they'll hit it again later in life when life kicks something up and be okay. But there are people who need long-term treatment, and we want to be supportive of that, and also support them in using healthy coping skills. For supporting ongoing professional treatment, I wanted to give you guys another resource from Bear River Health Department. They have developed this mental health resource directory on their website at brhd.org, and it's fantastic. I didn't even know about it until recently, and they update it every 6 months. And it has crisis services, outpatient services, support groups, everything in the community that could help you to find someone to help yourself or help your loved one. I do want to kind of put a heads up out there, or a warning, so it doesn't hit quite as hard. There are waits. Okay, the mental health crisis that is going on in the state is, I don't know, we don't even know what to make of it. But as mental health providers, we are busting it, I promise you. I was up here at 7:30 most mornings just to fit more students in this last year. Understaffed, and everyone, I know so many people in the mental health community, and I feel like we're really busting it, but we cannot keep up with the demand. So it is not uncommon to call an outpatient therapist and hear that there's a 6-month wait. And that is a really, it's just such a take the wind out of your sails. So I guess what I would say with that is don't wait until it's an emergency. At least establish a mental health care provider if there are any issues going on. Even if you just see them once a year, or if your child or the person sees them once a year, so that you have access. And there are more people coming into the community. And I would welcome anyone to call me. If people call me personally, we just keep going until we find someone. But it's tricky with the wait, so kind of heads up about that. When you're supporting someone long term, it's really important to keep healthy boundaries and remember that you are not the therapist. If you're not, you are the mom or the friend or the wife. And to set those boundaries, Gary gave that illustration this morning of putting the oxygen mask on your own face before others. And when we have people that we love who are struggling with this, it can quickly consume our lives. And so sometimes we need to direct them back to their therapist, especially if it's more like a neighbor kind of person of like, oh, that sounds concerning. Have you talked to your therapist about that? When do you see them next? Or if it's setting boundaries around middle of the night calls that aren't a life-threatening nature. Really be willing to be kindly direct with people about that, because it's easy to try to do too much right away, and then people get overwhelmed, and then they do completely abandon the person. And that's hard for people too. So it's better to give less and be able to do that consistently for someone than to empty your tank and then bail, okay? Yeah, and some ways that you can support long-term care, just like notice how hard they're working, notice what they're doing well, and comment on it. I think it's so wise of you to make your mental health a priority in your life. You're really a good example to me. When I was talking to one of my warrior clients and telling her, like, you're amazing. You are just, I see you fighting so hard, and it's inspiring to me to see the strength that you have, knowing the amount of pain you're in, and you did this today. And she's like, Monique, I wish my husband could see me that way. I feel like my family just sees me as a disappointment because I don't do all the million things I used to do before my depression. So really see them. I feel like as a runner, I always think about it like this, that it's like we see people, but the course they're on is largely invisible to us. And so there are these people that are on this steep course, right? And all we see maybe is struggle and breathing hard and going slow, and then we see a bunch of other people just cruising along, and it's easy to judge that, but try to consider what kind of course are they on, because it's pretty different uphill versus down or straight. Definitely, again, judgmental or shaming. You're still in therapy? Wow, I bet that's expensive. Or how long have you been going? Avoiding comments like that. Emotionally, we want to support healthy coping and resilience. You guys have heard enough about that. We'll skip that one. But how? I talk to my clients about one of the main tricks with managing a chronic illness when depression is chronic is finding this balance between leaning in to the struggle and the feelings and working with it instead of just trying to stuff it all down and press forward. And this goes for all of us, not just people with chronic depression. Balancing, like, letting ourselves feel with, like, get a break from it. Even a therapist isn't going to tell you should analyze your stuff 24/7. Like, that's not good for anyone. So we kind of have to find that blend. And you might think about, as a friend, what are some like lean away kind of things that you might do to support them? When I was going through my weird little illness deal, I had so many friends just come and go for a walk with me. And sometimes we'd talk about what was going on with me, but a lot of times not. Just having a conversation about whatever, is Golden State going to come back and take it again? Or that's a sports reference for people who are not sporty, but talk about anything, whatever's of interest to the person. Get outside with them. Service, how I would recommend a service kind of approach is say, hey, I'm volunteering today in Canyon Cleanup. I'd love to spend a little time with you today. Do you want to come along? We also teach people a lot of skills, a lot of techniques that aren't like climbing right in there with your feelings, whether it's belly breathing or progressive muscle relaxation for anxiety, or identifying and challenging distorted thoughts for depression. I guess that one's a lean in. But maybe it's even like, you're going to go to a yoga class, and would you invite the person you care about along? Lean in skills. And again, you can think about these for chronic depression, and then you can just think about them for being a human being. I don't know how many of you are familiar with Brené Brown. She's kind of a famous in our field person out on like YouTube and has written a lot of books, and I really love her. I love the things she has to say. And she has a Netflix documentary out recently, and a TED Talk also that's really great. And she notes that currently this cohort of US adults, were the most overweight, addicted, in debt cohort that this country has ever seen. And in my mind, it's because we don't know lean in skills. It's like we feel discomfort emotionally, and we just want to make it stop, make it stop. The analogy I use is the smoke detector, which I see up there, that hard feelings are like a smoke detector. It goes off and you're just like, oh, turn that off. And I know I've literally done it at my home. I've pulled the batteries out and just make it stop. When what you really need to do is like go look around, because there is probably a fire somewhere that needs to be put out. And the longer you let it burn, the harder it is to put out. That's how feelings exactly work. Although they're uncomfortable, they alert you to the fact that there's something really important going on that you need to investigate, not avoid. And so this is the work of therapy that we do with people generally, of teaching them how do you work with these feelings instead of just doing anything you can to make them stop. And that's ultimately what suicide is like this ultimate way to try to make uncomfortable feelings stop. And so we teach people to label their feelings, access them, or let yourself feel it, and then process, which, that's a whole deal, but basically listening to your feelings non-judgmentally, responding to them with compassion. Once you do that, it allows you then to go to the logic part of your brain. And I'll wrap up on this idea. We have two wonderful sons. And I can think of, you guys know when you have kids and they're little and they're on their bike or scooter and they wipe out and they come to you and they're all scraped up and bloody and crying. And like the first thing that you do, they're like, Mom, I skinned my knee, and they're, and they're all distressed, and you're like, oh no, what happened? And you ask, and you're a curious listener, right? And they tell you, like, I was riding my scooter and I hit this rock and I wiped out and banged my head. And you validate and you show compassion of like, oh, that sounds scary. You know, and yeah, it is scary. And you let them do the feeling stuff and you make it safe. And then you'll feel like this shift, this opportunity where they've kind of gotten it out now. And now you can say, hey, how about we go in the house and we'll clean it all up and we'll put a Superman bandage on and then we'll go play some dinosaur Monopoly. And, you know, and then they're little troopers and they come in and do that. And that model is very, it's simple. It's something we do all the time, but we don't do it well with ourselves, quite frankly. And we don't always do it well with others because we're just like, quit hurting, I want you happy. And so by attending to those feelings, that's always step one. Then you can help the person go to like, all right, what are we gonna do? What are you gonna do that might help this or might fix it? So in your role as someone who cares about someone struggling, you might kind of think about how you can help them with that, find that rhythm of lean in, lean away. It's amazing to me, my warrior clients, how much we laugh in therapy. I goof around a good bit, and some of these most depressed people I know, we laugh a lot. And then we get serious and we dig in. And it just, you know, that rhythm kind of works. So something for you to think about. Do you guys have any questions? I am out of time. Yes?
What was the name of the video you that had the Netflix documentary?
Oh, Brené Brown. So it's like Renee, but with a B in front, B-R-E-N-E, Brown. Her TED Talk is, if you Google Brené Brown TED Talk vulnerability, she is amazing. And like several great books. And the Netflix documentary is really good. And she's got an awesome sense of humor. It's just like super entertaining anyway. She's got a few TED Talks. Okay.
My question was about mass shootings. Are these people just suicidal and do you have some insight into why it's happening so much?
Oh, I have guesses, just guesses. But there are different profiles of people who do things like that. And that, you know, that goes a ways beyond someone with depression to this piece that, you know, there's more of that like justice or revenge kind of piece. And oftentimes those people, like if you looked at their adverse events that Dr. Red was talking about, I bet you we're looking 7+. I will be around. I'm really looking forward to hearing Lieutenant Governor Cox's talk, but I'll be around too. So if people have any questions, feel free to come say hi and ask. And I'm up here at USU mainly, and I will leave, I guess, will I leave these up here if people want the Safe Utah? And then this is a nice little pocket guide for if someone's suicidal, the steps in a little summary form. And thanks so much. Appreciate it.